Thank you very much. My name is Imelda Balchin, and I am actually maternal and fetal medicine subspecialist in Malaysia. I've worked in the UK for 17 years before I've worked in Malaysia for 9 years. So I've looked after many pregnant women who have been fasting in Ramadan with diabetes. So today we're going to look into playing it safe for our pregnant mothers. And the first thing we need to look into is that there are physiological changes in pregnancy that we need to know about. And changes in pregnancy makes a very big difference when you compare to non-pregnant women, is that pregnant women, they will have increase in blood volume by about 1.5 liters. And that increases the workload of the heart, and there is an increase in heart rate by about 10 to 15%. Secondly, we find that in pregnant women, they often have lower hemoglobin, and some of them do have anemia of pregnancy, especially in Asia. You do find a lot more women with anemia in pregnancy in Asia as compared to in the Western world. Thirdly, when a woman who is pregnant is fasting, the blood glucose, even when they are not on any diabetes treatment, the fasting glucose would be lower than a non-pregnant woman because of metabolism increase during pregnancy. So if you are comparing non-pregnant women without diabetes and a pregnant woman without diabetes, the pregnant women fasting blood glucose would be lower. And that difference is higher in the middle pregnancy to late pregnancy when compared to the first trimester of the pregnancy. The other thing we need to know about is that peripheral vascular resistance in pregnancy reduces to allow for increased blood volume to the uterus. And so during pregnancy, blood pressure does drop. So these combination of changes can affect symptoms and fatigue level of a woman when they are pregnant, even when they're not fasting. Blood coagulation also increases in pregnancy. This is a normal physiological change in pregnancy. And so pregnant women are more predisposed to venous thromboembolism. And so we need to be ensure that our pregnant women are not dehydrated when they are fasting, so that we do not increase their risk of venous thromboembolism further. And finally, of course, being pregnant is a state of insulin resistance. And these are changes in pregnancy which increases your need for insulin if you're already having diabetes before pregnancy. So we're going to go ahead with how a lot of pregnant women are not given this information. We find that many pregnant women do not know that they can be exempted from fasting if there is concern on the health of fetus or mother, the health of the fetus or the health of mother during the Ramadan. A lot of surveys has been done in many countries about their information and their knowledge about whether or not pregnant women are exempted when there are health issues or health concerns about the fetus or the well-being of the pregnant woman. And so we got to make sure that this information is made aware to all pregnant women, that it is okay if you're not well enough to fast, or if there's any concern with the fetus, that they are actually exempted from fasting in Ramadan. So having said that, a lot of studies have been done about whether there's any evidence that fasting in healthy pregnant women would lead to any adverse pregnancy outcomes. And we found that many studies have not shown any evidence of that. A lot of times, women who have fasted in Ramadan have come through it without any problems to their health or the health of their babies. But the exception is one study. There's one study that showed that fasting during summer can affect the fetal growth, and that we do find significantly less amniotic fluid in this study. And I'm going to show you which study this is. This is a study called Ramadan Fasting and Pregnancy Implications for Fetal Development in Summer Season. So you can see that the one study that showed reduced fetal growth in women who fasted in Ramadan are the ones who are fasting in summer season, when you see longer daylight hours and longer fasting hours. So this is a published in 2015, and I'm going to show you that what they did was they looked at 160 pregnant women in the second and third trimester of their pregnancy, and the fasting group was 83 women, and the non-fasting group sample was also 83 women. They looked at the fetal measurements of the head diameter, the abdominal circumference, the femur length, estimated weight, and amniotic fluid index, and they found that they were significantly different when we compared women who were fasting and women who were not fasting. And so in their conclusion, that they demonstrated some adverse effects of Ramadan fasting on fetal development. However, don't forget, this was a study done in a summer season where it was relatively hotter and longer daylight. So bearing that in mind, that my advice would be for all pregnant women to ensure that if they were going to fast in Ramadan, they do not extend the length of the fasting unnecessarily. So I also recommend that all pregnant women seek advice from their obstetric doctors before fasting in Ramadan, because there are certain conditions that I would recommend that they should not be fasting. And these are women who actually have nausea and vomiting. They are already dehydrated, and so they should not be made to fast during Ramadan, knowing that, you know, women who are pregnant are more at risk of venous thromboembolism. So we got to make sure that they do not go through Ramadan too dehydrated. And of course, women who are bleeding should not be fasting in Ramadan. Women who are requiring anticoagulants in their pregnancy, these would be women who have had previous thromboembolic disorders, women who have abnormal coagulation problems and requiring anticoagulants. And there are women who have heart valve disorders who need anticoagulants. My recommendation is that if they need anticoagulants, then we should not allow them to be dehydrated with fasting, because that would increase their risk of having thromboembolic problems. And then there are women who have preeclampsia. They are also more predisposed to venous thromboembolic disease. There are women who have fetal growth restriction where the babies aren't growing so well. And there are women who have diabetes on insulin. Now, when we talk about women who have diabetes, you can talk about different types of diabetes. There's gestational diabetes, type 1 diabetes, and type 2 diabetes. However, for ease of management, it's much easier to divide them into two general groups. That is, women who have diabetes on diet control and women who have diabetes on treatment. So when we look at blood glucose targets in pregnant women with diabetes, this is the most important thing. It does not matter when they are fasting or not fasting. The main aim is to ensure that they achieve targets of their blood glucose with a fasting level of 5.3 or less. And if 1 hour postprandial of 7.8 or less, and 2 hours postprandial of 6.7 or less. Now, depending on which guidelines that you follow, American guidelines and UK guidelines may have slight variation. there are certain guidelines would recommend 2 hours postprandial of 6.4 or less. But here in Malaysia, we follow a guideline of 2 hours postprandial of 6.7 or less. Now, when we look at women who have diabetes on diet control, I do encourage these women to fast if they feel that they are able to fast. And those who have diabetes on diet control should know that the most important thing is that they need to keep their self-monitoring of blood glucose within the blood glucose targets after breaking their fast. So you can fast, but make sure that you're able to control when you are breaking your fast to continue eating healthy, balanced meals containing high fiber, even for breaking fast. The problem lies in actually having good control and discipline when people are breaking fast. There's a lot of family involved in together when they're breaking fast, and a lot of people will go for high carb food and high sugary food when they're breaking fast. We have to advise our pregnant women with diabetes on diet control that they got to keep their diet control. They can't be breaking their fast on high sugars and high carb diet, because their blood sugar is going to go so high that it's going to affect the well-being of the baby. And so we still need to keep that target of 6.7 or less 2 hours after breaking your fast. And that can be a problem to many women because, they've had their fast all day and they want to break their fast with something higher in calorie, but that is going to cause problems if their blood sugar goes up too high. And so the problem with women who have diabetes on diet control when fasting is that they need to be able to break their fast with healthy meals so that they still need to keep their blood sugar within target range afterwards. If they can do that, then go ahead. That's absolutely fine to fast in Ramadan if you're able to keep to that healthy, balanced eating even after breaking your fast. If someone who has following breaking their fast, they're not able to keep their postprandial blood glucose within their target blood glucose, even with treatment with metformin, then my recommendation is you do not need to fast, because if we need to give you insulin to keep up with high calorie and high blood sugar when you're breaking fast, then, it's much better if you go back to your previous healthy eating during the daytime, small amounts of food, but more frequent meals, rather than not eating all day and then binging when you break your fast and then requiring insulin. So that does not help with the health of the mother or the fetus if their blood sugar goes out of control such that they suddenly need insulin where they don't need it. They didn't need insulin before the Ramadan. So we got to keep a compromise and a balance between women there are women who are able to control their diet if they're not fasting, and there are women who are not able to control their blood sugar when they're fasting because they're breaking fast with high carbs. And if they need insulin for that, then my recommendation is it would be better not to fast. Women who are already on treatment with insulin, the general advice is the problem that they face is that hypoglycemia during the daytime when they're fasting. So when they are breaking their fast, they're more able to control their blood sugar with the insulin regime that they are taking. However, during the daytime, the challenge for them would be to try avoid hypoglycemia. So if you're able to control the insulin such that they don't have hypoglycemia during the daytime, and they don't have and control their insulin levels such that postprandial after breaking fast, their blood sugar is still within target range, then that is absolutely fine to fast in the month of Ramadan, but it's going to be more challenging for them, such that women such as these who have this challenge to keep their blood sugar under control and trying to titrate their insulin would be able to do this if they have a personal doctor to help them to titrate their levels of insulin. So the general advice is for majority of women who have insulin, who need insulin, is that not to fast in order to avoid hypoglycemia. The exception are those who have personal doctors and are able to control their blood sugar using insulin infusion pumps and using scanners. And in that way, they are able to maintain a much better blood sugar levels during their pregnancy. So the general advice for pregnant women who are fasting in Ramadan is that before you start fasting, get obstetrician's advice, because, you know, we need to assess the general well-being of the patients, making sure that they're not someone who is higher risk of venous thromboembolism, that they have normally growing fetus, and they are able to fast without compromising their health. My recommendation is that suhoor, when you are having your meal before Fajr, is mandatory because we don't want to extend their fasting time. We have seen in that paper that was published about fasting during the months of summer, where the daytime is longer, there was in that paper evidence of reduced growth in the baby and reduced amniotic fluid, such that my recommendation is that you do not extend the fasting time unnecessarily. Make sure that women who fast take their suhoor in the morning and break their fast on time. Do not lengthen their fasting time. And if your fasting in Ramadan happen to fall during the summer months where there is summer heat wave and longer daytime, it's one recommendation. It is better for them not to fast. This year, Ramadan will fall in the month of March. So this year, it may be favorable to fast during Ramadan because it's less likely to be a long daytime fasting and less likely to have a summer heat wave. And the recommendation is that after breaking fast and between fasting, that pregnant women should be drinking enough water to keep themselves well hydrated. They should still drink 8 glasses of water in between fast, and keep to healthy eating. Do not binge. Keep to your target blood glucose. If you develop symptoms of hypoglycemia during the daytime, please break your fast. And if you find that the baby who is already in the 3rd trimester has reduced fetal movements, please break your fast.